Good afternoon, everyone. How's everyone doing? Happy Labor Day. Today is Tuesday, September 8th, and we are back to it. It's hard to believe summer has already passed us by. I hope everyone had a safe and relaxing weekend. And of course, for all of our residential staff that work no matter what, holidays and everything else. We thank them for being there over the weekend while some of us had the time off. I should start off by saying that my James Stannon filled in for me last Thursday, and I had a chance to watch him, and I thought he did an outstanding job, James. So if you're listening anywhere, thank you very much. Aside from the technical difficulties, which can happen to anyone, I thought it was an interesting um, um, experience, and I was really happy to hear it. You know, one of the things that makes me proudest is when I see examples of people that are staff that have grown into new levels of responsibility and acquired new skills, and it made me very proud to see James function in that role. So thank you, James, very much. Uh, we have today a special guest that's been on at least 2 times previously. Karen Franklin, who is our oversees all of our human resources, is going to join me in a couple of minutes to talk about our response thus far to the mandatory testing for all of our congregate care or our residential programs. And that's a big number to get through, 300 and some odd. Karen will give us the exact numbers. We need to keep working on that. I know the results are, Karen tells me, are coming in fast and furious. Even today, and hopefully as we go into this week, we'll see a huge, another number, a large number coming in for people being tested. But we'll have her come in just a minute. But we're going to start off as we typically do in our virtual town halls, and that is looking at the data. We know that Massachusetts has predicated all of the reopening that we've been able to do based upon this data, and we are making decisions according to how the numbers tell us we are doing and faring against this formidable pandemic. So as of yesterday, the number of deaths now in Massachusetts are at 9,133. There are 123,000 confirmed cases of COVID-19 in the Bay State. It's an increase of, well, 73 more people died to give us the 9,133. Last week it was 111. In the United States, the total deaths are now at 189,000, with confirmed cases at 6.32 million. The dead people dying in this past week were at 6,000, which was consistent with the number of people that died the previous week. 6,000, guys. It's just, I know we've been talking about these numbers for months now, but I still just, I just think about the families behind every one of those numbers and what they are dealing with this week as they've lost a loved one. Globally, we're at 893,000 souls gone from this earth, 27.4 million confirmed cases. The number of dead increased by 45,000. This week alone, the previous week, it had increased by 34,000. So this is a virus that continues to plague us in real numbers. I thought it might be interesting to take a look at some of the data that Massachusetts is compiling and using in some of the in the way it's working to control the spread, community spread of this virus. And so we're going to take a look at a few towns that we either have programs in or that are kind of in this general area. So I thought we'd start off first with Woburn, since that's where our home office is. And in Woburn, in the past 14 days, there have been 14 new cases of COVID, and the positivity rate is 0.68%. So that's pretty good considering the size of Woburn. If you look at some other towns nearby, we look at Wilmington, had 10 new cases with a positivity rate of 1.15. Again, this means that for every 100 people tested, there's going to be 1.15 people confirmed with COVID. After Wilmington, I thought I'd throw Winchester in there, has less than 5 cases in the past 14 days. Positivity rate, Winchester is 0.287. Moving on, we have large program in Westford, 9 new cases the past 14 days, a positivity rate of 1. It's pretty good. Weston I threw in there just because it's in the general vicinity. You know, you imagine that we're traveling, we're doing things, we're trying to ease back into our lives, and so you know it's not unlikely that we may do business or have reasons to go to these various surrounding cities and towns. Weston has fewer than 5 cases in the past 2 weeks, 0.72 positivity. Moving on to Wakefield, less than 5 cases. Waltham, 45 cases in the past 2 weeks for 0.69 positivity rate. North Reading comes in at 7 at 1.2. Reading is at 11 cases during the past 2 weeks. And I threw Saugus in because I know we've got some staff that live in Saugus. 25 cases in the past 2 weeks in Saugus, positivity rate of 2.19. That's higher than the state average, and it's higher than we really want it to be. So if you're in Saugus, really make sure you're following all of the safety protocols. And Stoneham at 6 cases and 0.69. We have then going into, I guess I have Lexington next, which would be less than 5, fewer than 5 cases in the past 2 weeks for positivity of 0.33. Lincoln, we have 2 programs in Lincoln, fewer than 5 cases, positivity case of 0.3%. Burlington, 5 cases. Billerica, 17, and Billerica, the positivity was 1.08. Lawrence, where I know we have staff living in Lowell, are higher. Lawrence is, as I know, an area of concern for the state at 184 new cases during the past 2 weeks, positivity rate of 4.61. That's much higher than where we want it to be. Lowell, 69 cases in the past 2 weeks for 1.5% positivity rate. So these are just a few of the cities and towns. Now, I was just curious to see, where does Massachusetts currently rank in the number of confirmed cases of COVID in the United States? And we come in at 17th place. And I got thinking, I know Massachusetts is a small state. I wonder how it compares with others based on population. And I was really surprised, and maybe some of you will be too, that Massachusetts is the 14th largest state in the union, which by population, which surprised me. So by those, that makes sense. If we're the 14th most populous state, that we would be someplace among the top 20 anyway for number of confirmed cases. But Massachusetts is still considered to be trending in the right direction, and we still have 4 of the 6 dashboard indicators that the Commonwealth uses in preparing guidance, and those 4 indicators remain green. So we are learning that we can manage routines, we can get back into some normal rhythms, so long as we are very careful about complying with the guidance that we've received from the various sources that we follow carefully. And yet I was told to remind our staff today that there have been, well, the good news is that people are using Navigating Life during this pandemic, which is an important tool, an extremely important way that families have to stay connected. But I've been told that there are pictures of staff not wearing their masks. You must wear your masks, please. It has been proven to reduce the spread and community spread significantly. And it is the least we can do to ensure that we keep our numbers low. If for some reason in the testing of staff that Karen is going to join us in a couple of minutes to talk about, if for some reason we saw an unusual spike that was inconsistent with what is happening regionally or across the state with other providers that do similar kinds of services, then that would mean that that there would have to be increased testing of all of our staff, and that's not something any of us want. So never mind the fact that if somebody gets the virus, they could have serious health consequences. So please, please remember, these are provisions that we have put into place in accordance with what we have been told by science and the experts that will help us to live life safely in this uncertain time. And these are the things that we're going to continue to do and will be part of NuPath policy and expectation for all of our staff. So please, please, guys, remember, this is no time to become complacent. And even as we look at some of the numbers being relatively low as far as new cases over the past 14 days in our surrounding cities and towns, that's good news, but we would not be there if we weren't following the guidance as we have been instructed to do. All right, enough of my lecture on that point. Greg, can we bring Karen up and have her join me for this next part of the conversation? There she is. Hi, Karen.
Hi, how are you?
It was so nice to see you face to face. Just even though it was masked,
Right.
it's good to see your dazzling smile. That's the one thing you can't see through the mask, isn't it? And I appreciate you joining us today because we're going to talk about a few things related to human resources. Because even as so many of the what gets sort of front page news as far as a response to the pandemic and coverage and those heroes and those amazing staff that are working in our programs that have seen us through the past 5 or 6 months of uncertainty. Your department has been working, I'll say overtime, but certainly in overdrive, because there's been so many sort of layers of additional oversight, expectation, guidance that has required and demanded response from the Human Resources Department. And I want to thank you on behalf of the organization for your leadership in helping steer this ship through all of those, all that confusion. So thank you very much. How are things going? Are things still good for you, or are you you're doing all right at home, and is everyone in your family okay?
Yeah, everyone's doing great. My family lives in Florida. Both my mother and father are remarried and live in Florida. They've both decided to stay there and not travel to Massachusetts like they usually do for the summer. So I think they miss being around family. My husband has worked the whole time, so it's been kind of transparent there. And then my daughter is now restarted school, and funny enough, one class is in Zoom, two classes are just remote learning, which means you can log on when you want, and one's face to face. So it's kind of like this hybrid model of different things. So we're navigating. She's working.
But how's that desk working out for her that your husband found and put together? Didn't he like find a desk and you were trying to find a computer, and this was back in
Yeah.
March, April
Right. Yeah, she's all completely adjusted. We have an unfinished basement that we had to quickly throw electricity down there, so it's half finished now. It's got a couch. It's got the desk for her. because we had downsized 2 years ago and we have a much smaller house. So yeah,
Mhm.
you know, the younger generation can be technology savvy anywhere. Just have to give them Wi-Fi and they're off and running.
It's true, and it's there's so many uh, there's so many implications of what this pandemic is doing. Uh, the changes, the influences that are going to be far-reaching, I think, for decades and decades to come, as far as sort of the distance learning, how businesses have uh, determined that they may not need the brick and mortar that they once thought was paramount to their business model. I know that we've learned a lot about our own operations and how we've responded. I don't like it. I don't like this distance thing, and eventually we will be moving our administrative staff back in here to into the structures of New Boston Street. But for now, we're taking it day by day, I think is the best way to say it. And right now, your challenge is trying to get test results from 300 and some odd staff. Will you talk to us about what that's been like and kind of how we're doing right now at this point? Should we be proud of ourselves, or uh, should we be worried?
So we embarked on this about 2 weeks ago, right? I think it was a Thursday or a Friday before I went on vacation for a week. So we got the news, right, pretty quickly from DDS and how we had to move forward. We were able to coordinate with 3 local venues that were willing to contract with us. We didn't want our staff to have to go and pay out of pocket and then wait to be reimbursed. We wanted it to be able to be billed directly to NuPath. So we set up 3 quick contracts there. We also participated in some of the pop-ups. So we sent out our communication. We had those contacts in place. We had the pop-ups. So we had to reach out to 375 people. So we had to determine who was the who that needed to get tested in the congregate care, and then everybody else surrounding that. It wasn't just people who might work directly in direct care. It could be anybody that's going to be going to the residence that's needed that test. So we have that to about 375 people. And as of this moment, and like you said, they are coming in, fast and furiously, is 125 tests are done. So that's 30% of the population. So we need 250 more tests completed. So I'm hoping by the end of the week we can see where we're at, and then we can send out another blast and see what's the holdup. Maybe people haven't been able to get to a testing site yet or get an appointment at a testing site. We're working very closely with our managers and our directors. A lot of our program managers are trying to get all their staff's tests and then submit them all together. So I think we'll see an influx when that happens. So thank you I guess we can say thank you to everybody, right, for jumping right in. That's the managers, the directors, the HR team, and everybody to put this together. And then the staff for just their willingness to go and do this and know that it's part of the job, that they do here at NuPath, and it's something that the state has put into effect. I haven't heard any feedback from anybody that isn't interested in taking the test or wants to depart from the field because of the requirement of the test. Everybody's just doing what they need to do.
Karen, we were talking about this before we went live, and or maybe it was earlier this morning, and you made a statement. Let me make sure I say it the right way. That the people that probably have responded thus far, um, I don't remember exactly how you said it, but they're the the early adopters or those responsible staff, that core group of people that you're not going to mess around. They know this needs to be done. They probably went out the first or second day that they could, got it done. Probably a lot of those same people are people that are watching right now this broadcast. This is the core in many ways of people that are would it be fair to say, or perhaps the most invested in what happens to this organization and how we are responding in a united and collective way that's going to bring about the kinds of outcomes that we need in order to be successful in battling this and getting through it and making sure that we remain solvent and that we're able to respond. the staff that maybe haven't yet responded, if you're watching this today, get out there and do it. Um, but these are staff that in some cases maybe, I can't believe it, but don't read their emails. Don't stay as connected. I can't believe it. Actually, that was sort of sarcasm. I don't know if I did it very well, because we have a lot of staff that are hard to reach, that are difficult to message around. This has been something that we've been talking about for years, and how we reach some of these staff where they are. How are we getting the word out? Are we relying on the managers from the residential programs to do all the heavy lifting, or is there anything more that we could do or should do, or it's just, I know this is a difficult
So
question to
no,
ask.
and I think I can go back to what you were saying and what I said this morning. So we have over 450 staff, and they all have access to email. It's been a challenge to to make sure that everybody checks their email. We've implemented a lot of new systems in place, so I think a lot of newer hires that went through orientation, some of these new processes might already have the email on their phone, and they were trained properly to put it on their phone. Then we have our legacy people that have always used their email, and those are the ones that got the communication, that they're reacting quickly. And then we have that kind of core in the middle, and it could be our second and third shifters, because they're doing overnight shifts, and maybe they feel less connected to the company. So um, in the inability, right, to check their email and to reach out to IT. So we've sent out communications to help support them, and show them these are the steps that you need to do if you want to get onto your email. When staff reach out and say, I don't have email, we educate them that they do and how they can get onto it. But your last question is, yes, we are relying hugely on the managers, because they're in the heart of the program every day too. And we've asked that they post these things and directly speak to each of their staff members, so that everybody is aware that this is a requirement that has to be done. Because when we get to that deadline,
Hmm.
and then we have staff that aren't tested, we would be non-compliant, and we wouldn't be able to allow these people to work shifts. So you've got a couple things going on. You'd have people that wouldn't be able to work their shift, but then you would also have a staffing crisis, right? To try to care for our clients, and how do we get the staffing that we need? So the soon as everybody can get that test, the better it will be for everybody. Like you alluded to, let's keep our masks on. Let's make sure that we're doing everything that we're supposed to do to stay safe, because we don't want to have to embark on getting 375 plus people tested every 2 weeks. I mean,
No,
that's a
no,
task.
and that's what it would amount to, probably, if I forget, what do they call it? What the kind of testing that they would do then to
This is a baseline that they're doing now, and you're right,
but
there
if
is a
there was a spike, or if we had an increase, then there would have to be surveillance. Is it testing? Is that what they're calling it? Or um, whatever I can't, I'm drawing a blank right now, but it's when there's going to be a much closer look
right.
at community spread in particular areas. And I know that there's great concern in some of the larger communities. We looked at Lowell and Lawrence, that are well above the spread rate, or the transmission rate of some of the other smaller cities and towns. And so we don't want that kind of
No.
scrutiny. We want our people to be tested, and we want to comply in a timely fashion. We heard this morning on an ADDP call that this is something that every organization, but we know that already, has to do in Massachusetts. That's
No.
so. In all likelihood, uh, so many of the staff that work for NuPath probably work part-time at some of these other organizations, or if they have a second job, it's likely to be with one of these agencies. So one way or another, they're going to need to have that test, and they'll have to have proof of it, either for us or for their other organization. So this is not something that anybody's going to be able to, you know, duck or hide from, or go to another agency if they don't, for some
Right.
reason, want to be bothered with it. This is something that's going to become part of our lives, I think, in so many ways. I really do think that this is probably just the beginning of what's going to become a much more pervasive, or much more institutionalized testing model, where people are going to, especially if there's the direct saliva, some of the other new sort of innovations for testing have been discussed, or you've seen them in the news, that it becomes cheap enough, and because it opens so many doors, doesn't it? If you can confirm, definitively, hey, I'm here today and I don't have the virus today. It's like we said before, there's a chance that you could go through an entire day, throughout your business not coming in contact with anybody that's positive for COVID, but you just don't know. And that's the problem that's been driving so much of this. Um, all right, well, we'll stay on that, and I hope you'll keep us posted so I can, let people maybe know on Thursday during our Unity Forum. And if you're a staff person out there watching that has not yet been tested and you need to, please make it a point of doing it so we don't have Karen lose any sleep over whether or not I'm sure everybody's going to come together and is going to be comply with this guidance or this mandate, really. So you've got that going on, and there's a few other things that are happening too. We didn't say we were going to talk about this, but I think I'll just maybe mention it that NuPath is a union organization, and our union contract would typically be would end, the 3-year contract would end in October. Is that right? And so across our region, a number of other organizations that are also union, they have been seeing their contract extended by 6 months, and so that's something that just due to the confusion and what an unusual and uncharacteristic year this past, or let's say the past 6 months have been anyway, it makes it very difficult to have any kind of thoughtful and sort of legitimate conversations about what the situation is going to look. So we can imagine, we don't know yet, but we can imagine that our contract will be probably postponed as well. So in case anybody out there was wondering, but that's still taking a lot of conversation behind the scenes. The other thing that is there anything that you want to say about that, or is there anything that people might be wondering, or?
So the union would reach out to its collective bargaining agreements if it was going to be an extension that we would put into place. So they would have a voice and they would be able to talk to their union rep. But I think that most agencies and most collective bargaining unit members have opted for that because they want to have these contract negotiations when there's a little bit more known of budgets and where we are with COVID and how's everything going. So I wouldn't foresee it being a problem if they, if we and the union, decided to put out, the idea of extending it. I think it would be for everybody's benefit, but that's the union members to decide with their union reps.
Right. So the staff that belong or part of the collective bargaining unit could expect to hear from leadership within the union.
If we embarked on an extension, that is correct.
Yeah. So that's been happening, and as we think about what 2021 is going to look like from a fiscal perspective, I think I've shared this before that we have managed to kind of cobble together a whole array of financial assistance and aid that's been made available either in the form of loans or grants. So there's lots of pockets of money that we're still waiting to kind of hear about and to kind of see how it really hits our bottom line. So in fact, we had a finance committee meeting last Tuesday evening outside, but we were together, socially distanced, and Bill had a whole long list of these things that remain threats. These are possible threats to our financial situation, increases in various costs to our bottom line, and then there's these possible benefits. These are the PPP loan and the forgiveness factor on that, and a bunch of stuff that we're kind of taking a day at a time. But one of the big things that has been outstanding, I thought we'd talk about a little bit just in the time that we have left, is the health insurance that enrollment would begin in October. Do you want to talk to us about what that journey's been like for you as you've kind of help guide us through the negotiations with, or maybe we should we start with the slide that I prepared and see if just to put some context to it. Greg, can you pull up that slide? I think the average person might be shocked to know. Do you know off the top of your head, like what we spent? I should put you on the spot because I probably would have had a hard time knowing. I know it's one of our most expensive, our biggest costs for staff benefits. But the year 2019 to 2020, it cost us approximately $1.4 million to insure our staff, the staff that are participating.
Yep.
And that is a hell of a lot of money because it's not even that many staff. It's like 160 odd staff, isn't it? It's not all 450 people, because a lot of people, if they're part-time or if their spouse, if they have used their spouse's insurance, or if they're on the connector, they don't utilize our insurance. So even for that small subset of staff that we insure, it was 1.4 million. And then we found out that there was going to be an increase this year, and it looked like at first they were talking about 23%, but I think we think it's going to come in more closer to 12%. Is that right? And then that would be, for us as an organization, it would increase our cost to 1.6 million. Talk to us about how we're looking at this, and what some of the changes might be. I know you don't have maybe a specific breakdown of what it's going to cost staff, but what does this mean for us?
So let me just start back that our benefit year runs from October 1st to September 30th, right? So we embarked probably about a month ago with negotiations with our benefit broker, Clark and Levy. And what they do is it's quite a process. They have to take the whole entire survey of all the employees, at NuPath. They look at all the claims from a prior year, and they do what's called put it out to bid. And what they do is they put it out to Harvard Pilgrim, because that's who we have, but they put it out to Tufts, and they put it out to Blue Cross and Blue Shield. And you get these rates that come back, and sometimes you get people won't quote. And what does that mean? That means that when looking at your portfolio and how it stands, they don't want to quote, because maybe it'll come in too high. Maybe they don't like what they see with claims and things like that. So we're a prisoner to the process, right? So what happens is then a bid comes in, and the bid came in at 23%. So obviously we all fell off of our chairs and said, well, that can't be. Nobody wants a 23% increase. The organization, individuals. So what they do is they try to use other bids that we might have gotten against one another, but people didn't want to bid this year on our insurance. I can't say exactly why, but what I can say is because of what our rates were with Harvard, which were fantastic, right? Because we did so great over the last couple of years with the low increases. And then probably our claims for the year. We might have had more heavy claims over the year. So most said they didn't want to bid. So then if you don't have these other bids from other companies, it's very hard to go back to Harvard Pilgrim and negotiate. And that's how we have been able to negotiate the rates down over the years.
Right.
So there was one other bid that came in a little bit lower. So we were able, but that's it's not really an insurance. It's actually like a conglomerate to change the way we do things and put it into like a conglomerate of a health insurance. And it's not something that we really wanted to do.
No.
But we were able to use that, and we were able to get them down to, I believe it was 17%. And we said to ourselves, well, I don't think that's a good number either. 17%, that means if you're paying the individual, the dual, or the family, it's going to go up by that 17%. So we said, what else can we do so that we don't change the benefits that we're used to, right? We're used to the way our doctors, and we didn't want to change health insurances. So they were able to say, well, if you increase the deductible of a plan, that can bring down your rates. So we haven't not finalized that, but that's where we're going. Hey, we think the employees would appreciate more the 12% increase, which is what would be coming out of their biweekly pay period, but it makes the deductibles go up. So the way it stood before was it was $1,000 deductible for an individual, and it was $2,000 for dual and family. And through an HRA, NuPath would always cover half of that. So now we're addressing the thought process of it would be at $2,000 for the individual, and it would be 4,000 for the dual and the family. And we're just trying to finalize what that HRA would be able to pick up, you know.
Mhm.
So what we're trying to do is finalize those things, get a communication out to staff. It's really important that they read the communication. So it goes back to what we talked about earlier with email, and then the fact that we would be launching it through Paycor, so they would need to have logons to their Paycor so that they could do that. And then 4, we'll be doing all virtual meetings. So we won't be doing any of those in-house meetings that we did, but we'll do virtual meetings so that people can dial in and ask what questions they want to know. One other important factor is the fact that right now we have an FSA, independent care, through WageWorks, and we'll be leaving WageWorks and going to one called General Dynamics, which is it's to our benefit because WageWorks just hasn't been a very good customer service to us as the employer and to the employees. So we feel like we're going to build, and we've already built a much better relationship with these folks. So it'd be very key that people listen, check their email, join these virtual meetings because they'll need to know what that means when we're switching FSA providers. And then if we continue on with the HRA, they'll be the new HRA provider as well.
Since I've been here at NuPath for however many years, since 2003 or whenever I started, the percentage of employee contribution for the individual, dual, and family plan has remained the same. It's not something we've touched. So I know for individual, it's like 15. Is it 15%? I should know this.
It's 50. So it's 85. We cover 85% of the individual and 70% of the family in the dual.
70.
Or
So
75.
when we were looking at 23% or the 17%, that was a substantial increase to the employee deduction, even if we didn't touch the percentage that the employee was responsible for. And you know, we the NuPath board and the finance committee has routinely pointed out the fact that NuPath staff are well, I've heard it said damn lucky because out in the regular world, it's not, you know, companies don't pay as generously as much for employees' health insurance, or the health insurance is less than, you know, adequate sometimes, or at high levels of deductibles. But to me, it's always been something that I've just been so hesitant to do. So this is all of this is being done with an attempt to keep the 50%, 30%, 30% the same. I mean, it's that part, not pass along an increase, because even though it's an increase for staff, it's a huge increase, you know, at the 85% or the 70%. I mean, that's the bulk of what the cost is per plan. And it's really, I mean, it's having a major impact on how we, I mean, when you think about an additional 200 odd $1,000 from where we were last year for a product that is essentially not as good, you know, if you look at the deductible. Now we're going to, you know, try to make up for that to somewhat. I mean, it's really it can be a little discouraging, but even at the 12%, we're looking at increases of, you know, for family, like $25 a paycheck or something. It's so it will add up. I think, you know, as far as what the increases are. And I don't know what to say about that, but I know that you've been, you know, again, at the front lines of working in negotiating these things. And I just wonder if staff know how hard we try to, you know, control the costs and to explore every creative avenue to ensure that we don't have to pass on anything more in expense wise to the staff. But
And I want staff to know that it's not NuPath, right? We're not alone. This has been an ongoing issue with healthcare, you know, in the United States totally. I have some friends that pay 50-50. The company only pays 50%. And the plan has like an $8,000 deductible. So
whoa.
there are some, you know, much worse situations to be in than this. So, and like you just alluded to the fact, okay, so for an individual plan, it has the least impact. For the family plan, it has the most impact. but it's really the majority of the impact is on the organization, right? Not necessarily on the individual. And we do want to keep this good plan. And we like the fact that we are able to pay such a large portion of it, but it's certainly not a negative reflection on NuPath. I think it's just a negative reflection on healthcare as a whole
In
in the
general.
United States. I was saying I remember when I used to pay $18 biweekly
Yeah.
and have no deductibles and no co-pays, and so
Yeah.
it has just grown and grown over the years. And as you said, NuPath is just trying to always navigate how can we keep it affordable for our staff.
And it's a funny benefit, isn't it? Because it's like one of those things where it's not like vacation time where, many staff, they're aware down to the hour of how much vacation time they have or how much sick time they have. Health insurance is, you don't care about it until you need it, and then you're suddenly, you know, you can have a rude awakening if you haven't had occasion to have to really use it before. If you're just starting, if you just your family's just beginning, or you just have a young family and you had never really gave it much thought, as to what an expense it is. But it's something that's so critical and so important. We talk a lot about our staff being the most important asset that we have of everything that makes up NuPath. These dedicated, well-trained, loyal staff that we have in every corner of the organization. And our staff's health is got to be number one, or a very close second to our clients' health. And I probably would flip that, though, even think as I say it, because if we don't have healthy staff who have healthy families, then we don't have any workforce really, as far as taking care of our mission and the people that we're entrusted to care for.
Yeah, and just a point of 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 thinking about it the way you said it. So in 2011, my husband had a heart attack, and we won't talk about that piece. That one heart attack cost $47,000 when
Ah,
all was said and done. He had two of them back to back, so it was almost $100,000 in bills. So with $100,000 in hospital bills, I'd be more than happy to pay the $4,000,
of
right? Because that's all you're responsible for in the end. So if you
course.
look at it, all right, so if you're going for small things like an MRI, or you hurt your knee, or you sprained your arm, then you get the couple $100 bills, and those are painful to the week to week, family household expenses. But if you had a catastrophic event like that, owing $4,000 and putting yourself on say, a payment plan with the hospital for that is more reasonable. The other thing I didn't mention is our FSA. Last year it was 2,500. The IRS has increased those limits, so we're looking at increasing them as well to staff, so they'd be able to increase their limit on their FSA, which could help also offset any expenses that they might incur with a higher deductible. So, like I said, we're finalizing those things. Hopefully, have a communication out no later than Thursday or Friday.
It's been a busy summer.
It's been a busy summer.
It has, but you make it look easy.
And the other thing that we have been doing is, and this goes back to what we're talking about with email and everything, is we're also trying to get everybody CPR and first aid and any other certifications, because everything kind of got put on hold on COVID. So a lot of staff have been getting communications from Anna LeBron about where their CPR and first aid stands. So that's another thing we're embarking on, is getting everybody current with that. So if anybody has any questions, reach out to me. People have been reaching out. People have been sending in certifications that they might already have, or going out following the directions and doing the online training. So again, we've thrown a lot at you, right? It's going to be open enrollment, you'll have your responsibilities. It's getting tested, you'll have your responsibilities. Getting your certifications updated. We have to start getting to this kind of post COVID and back to this, I hate to use the word new normal, but that's what it is. It's a new normal. And we have to start going back and looking. We thought we would be out for 2 weeks. We thought we'd be out for 4, maybe 6, maybe 8. Here we are 5 months later, trying to get back on track.
And I've been hearing more and more than I had been hearing for the past few weeks about people, really forecasting possibly a reversal of some of these lifted restrictions as we go into the fall, if people are expecting to see an increase. I hope that's not the case, but
So,
worrying that people have been, this hit us just before summer, spring and summer, so people have been able to do much outdoors, and that's created opportunities that otherwise wouldn't be there. But if there's 2 feet of snow on the ground, people aren't going to be out in Jubilee Park, to create more distance. It's, we're going to really be limited in this. People return indoors and remain there, pretty much exclusively for the duration of the winter. The fear is that there'll be more spread. Well, I'm going to ask Greg if there's any questions, but before I do that, um, we have or it's the 16th, so I guess that is a week from tomorrow. We're hosting a flu shot clinic here at New Boston Street. They tell me it's going to be a drive-through. You're going to stay in your car to get the shot, and we know that experts on every level across within the state and nationally and globally are saying get the flu shot, even if you don't typically or you sometimes miss it. So this is an opportunity that we're putting together, thanks to Sharon Pitts and her team, to make this available. So are you going to get a flu shot?
absolutely. Yep, I do every year. I've been doing it for years.
Yeah, I put it on my calendar so I made sure I didn't forget. And are you and your team gonna get tested?
So the way it's right now, so I did get it tested at a pop up in Westford, but it wasn't in the parameters of the time. So I'll go get tested again. Some of my team is more apt to have to go to the programs, so they'll be tested. So half and half. So half of us will be tested now, and then as things start to evolve, and the other half will be tested.
I mean, it's something that's there for folks. I just don't know why everybody's not taking advantage of it. I'm gonna get tested. Hopefully, I meant to do it before today, but
We all got tested originally with the pop-ups, but that doesn't, right? It
uh,
needs to be dated August 1st and forward, so they don't technically count, but we did
yeah.
get it done once, and it's not so bad. I mean,
Well, I realize this has been, if there's any families watching, I guess you're seeing, behind the curtain or whatever the expression is. We've talked a lot about staff and things related specifically to staff. But Greg, are there any questions that I can answer or that Karen would be able to answer that have come in while we've been on this broadcast?
No, thank you guys. It was very clear. No questions came in.
good, okay.
Maybe they'll all fall in as soon as you get off this thing. Karen, thank you so much for being there, for your leadership in such important ways, and all the things you do on behalf of the amazing staff that work for NuPath. And people don't even know the half of it. I know they don't, because I'm sure I don't. The hard work that you put into ensuring that all of this is being done in such a smooth and efficient manner. So thank you so much, and for being here
Thank
today
you.
and giving information.
Yeah, thank you, and I couldn't do it without the amazing team I have. I have to say that. So
Yeah, we're pretty great, huh? We've got some really good people working
we
for
do.
NuPath. I'm very, very proud. Okay, thanks so much for being
All right,
here.
thank you. Bye bye, everybody.
All right, well, you heard it. If you haven't got tested yet, please get yourself to one of the testing centers that was on the email. And as Karen said, one of them, you just walk in. Karen, you're still there. I know you're
I
trying to.
know. Do I have to take myself off? Oh, stop sharing. Okay,
It
bye
could
bye.
be. It, there's like one of those things where, sort of awkward. You're like, should I just acknowledge she's still there? Um,
Dan, that was completely my fault. It hung up for a minute, so my bad.
yeah, well, things happen. Yeah, I know they do. And if you weren't there, I'm sure there'd be a lot more things things happening than are currently happening. So this Thursday, we will have our weekly Unity Forum, and I'm excited by the guests that we're lining up, panelists. One of them I know for a fact would be Mary Lou Colburn, who is our speech language pathologist. She's been around for many, many years. I've known Mary Lou for decades, and she is, uh, in my opinion, one of the best there is. And she's going to talk to us a little bit about her her take on what she sees happening across the region. She's a consultant to many different day programs, and I think she may be able to give us some insight, along with the other consultants, if we're able to get them, into how NuPath is kind of stacking up with some of our sister organizations, and how are we comparing with some of what's being done other places. You know, you sometimes get in a little bit of a insular world that you don't see direct examples of how other people are doing things and how they're responding. It's sometimes difficult to really measure how we're doing. So I'm hoping to hear a little bit from her. She'll tell us how she thinks NuPath's doing in the grand scheme of things. And it feels like there was one other thing I was supposed to mention, but it has left me. So, oh, we have had one positive test that's been a result of this wider testing that we've been doing, and I do believe that was a staff person. I just wanted to share that, but still very low rates, and we want to keep it that way. So wear your masks, wash your hands, social distance, all the things that you've been doing so routinely and so religiously, that has helped bring us to this point where we are finally beginning to engage again with the real world. Let's make sure we don't go backwards, and that we continue to move forward until there is some medical intervention or vaccine that's going to help us put this whole crazy experience behind us. We've got this, guys. We will do this together if we remain united. And thank you all for your continued excellent response to the important things that we're doing. So talk to you on Thursday. Bye-bye.